The time of suffering is almost over. In the Hermann Josef Hospital in Erkelenz, surgeons are operating on a woman called Edith Schulteis. The Dutch woman would have had to wait for months for an operation in Holland. These days, the German clinics in the border region, the so-called Euro-regio, are an alternative for swift treatment. A few years ago, Dutch patients were advised not to apply for treatments in a German hospital. The reason was that the infection rate for the multi-resistant bacillus types, such as MRSA, were 30 times higher in Germany than in Holland. The framework of the EurSafety Health-net has now seen the infection rate on the German side of the border drop to the Dutch level. German patients from the region known as Euregio can now apply for treatment in a Dutch clinic. The risk of them importing the MRSA problem has been reduced. This all means that the EurSafety Health-net is now one of the most successful health projects in Europe. Under the organization, 5 regional networks have been established. They are Ems-Dollard, Gronau-Enschede, Rhein-Waal, Rhein-Maas-North, and Maas-Rhein. The people taking part work together across the borders to find effective means to protect people from infections and the antibiotics-resistant bacillus types in particular. Hospitals and outpatient clinics, nursing homes, health offices, and microbiological laboratories. For patients infected with MRSA, it may take weeks or even months until things improve. During this time, they may be transferred to another hospital or to a doctor's practice. In the final analysis, the search and follow system must be used so that the patient is guided through the health system until the patient is free from MRSA problems and an infection can be avoided. The network partners have laid out clear and understandable guidelines for the hygienic care of patients and their treatment. Doctors, both male and female, can use the internet or smartphone apps to gain information on bacillus carriers and what is required in the way of antibiotics. The system is designed to avoid new strains of bacillus types making an appearance. We have been able to clearly reduce the rate of Staphylococcus aureus infections from 25 to 10%, which does not tally with the current international and German trends, where rising rates are apparent. Reference laboratories in the university clinics in Münster and Groningen have been doing valuable work in finding out the types of antibiotic-resistant bacillus. Now hospitals in the EurSafety-net are testing new types, such as ESBL bacteria, which use enzymes to neutralize the effective substances in antibiotics. 13 million people who live in the regions along the German-Dutch border profit directly from the EurSafety Health-net, and not just the increase in patient security. The EurSafety Health-net also plays an important part in mobilization between the two countries as far as healthcare is concerned. In other words, it's also an important building block for a united Europe.